Deanne, tell us a little bit about your story. How is treatment changing from your perspective?
Oh, I think that actually I'll answer that question by positioning things very, very directly in this COVID time. I think that as much as COVID has made life complex for everybody, both from a pure healthcare point of view and an organizational point of view, I think on the other side, it has positioned, it's become a window of opportunity because it's enabled clinical services, support, and new solutions to be used to be able to address perhaps situations that were there in the past, for sure, but that we would never have thought of addressing in the way that we can do that today. So at least it's a bad news situation to have COVID, but it's also a good news situation. And it's enabled us to show the availability, the performance, and the support for patients and for caregivers in very novel ways. If you look, for instance, at everything that's telemedicine or and the support for chronic disease management, but where the patient is versus having to bring a patient into the healthcare system all of the time. I think that the numbers have skyrocketed in terms of facilitating access for patients to their physicians because of these new solutions that were there before, but life just wasn't focusing on them as much as everybody is right now, and the impact can be considerable. And access as early as possible to the right people, to the right support to group. These are the things that are recurrent with what Alexandre was saying about diagnosing, being able to diagnose something early so that you can prevent a disease from increasing in terms of negative impact. These are all of the themes that are coming together in what we see in innovation today.
Alexandre, do you concur with Deanne? I'd love to get your perspective on, and this may be counterintuitive to our audience, all the stories about how COVID has edged out cancer treatments and other things because of the focus in the hospitals on COVID. But is there a silver lining to this gray cloud? Does COVID present an opportunity for new types of therapies and treatments and how to go about having that patient looked after?
Certainly, you want to optimize the time that you spend in hospital, and you want to expedite the test and the treatment. So certainly, when you look at the data and you have a digital test on your data, you can almost do that in real time. In fact, we have some early products that do that in 200 milliseconds in real time, quasi-real time, looking at videos of polyps for colorectal cancer. It's non-invasive because looking at the data, it's not actually doing a biopsy. So there's a lot of new ways to look at medicine, not just looking from a physical perspective, but also making sure that when you're going to do an intervention on the patient, you have looked at all the data to make sure that you do the right one.
I'd like to know about other impacts on clinicians now. It's not just about the patient, but are there new tools in place for clinicians? Deanne, what's your perspective on this?
Oh goodness, I think that all of the real-time communication with patients is the focal points that we mentioned before are certainly there in terms of cancer support, but in several other fields for sure. We see technologies that will help patients, but even healthier people, being able to stay at home, to be monitored when it's appropriate, to be able to have the support that they need from their family, from the community, and from the healthcare providers, to be able to be given in real time with better communication between everybody. And that can apply to decreasing isolation, Is it making sure that the patient is empowered appropriately to be using and to be compliant with what's being suggested as an action plan?
We're going to have to.
Those protocols are important for everybody.
We're going to have to take another break. I'm sorry, but that's the way it works. We'll be right back after these messages. Stay tuned.